Good morning, everyone. So good to see everyone. Good morning and welcome to our panel discussion titled Strengthening National Digital Health Ecosystems to Monitor and Maintain HIV Epidemic Control. I want to welcome everyone who's in the room and also everyone who's joining us virtually. Good morning, good afternoon, good evening. My name is Anna Garuro. I am the Director of Technology Solutions for ICF's International Health and Development line of business. I'm very excited to be here today in my capacity moderating this panel as the Data Exchange and Interoperability Group Lead on the Systems team at the State Department's Office of the Global AIDS Coordinator and Health Diplomacy, SCAC. This year's theme of driving effective and equitable digital health innovations is very timely and dovetails well with PEPFAR's new 5-year strategy. One of the key focus areas is to establish a long-term steady state of health data and digital ecosystems at country level, including a set of systems that are owned and managed by country governments that can see across disease areas and are integrated and provide accurate and timely information about conditions in the health system. Ours today will provide insights on efforts being made to work closely with partner countries to ensure that investments in data systems, collection methods, and digitization are actively integrated into partner country digital and data roadmaps. I'll go ahead and introduce our panel. To my immediate left is Ashneil Jain. He is the Senior Advisor for Innovation and Strategy, Office of the Global AIDS Coordinator and Health Diplomacy, SCAC. He supports the Ambassador at Large on strategy, development, and execution of PEPFAR, and is helping to design and embed innovation, policies, and partnerships across the program. Next is Mark Desalia. He is the Information Systems Team Lead at the Office of the Global AIDS Coordinator. He manages a team around the world that supports all aspects of PEPFAR's centrally supported information system portfolio. Next is Dr. Paul Beyondich, Data Use Community Lead. He directs Regan Street Institute's Global Health Informatics Program and is a Senior Medical Informatics Researcher and a pediatrician. He leads PEPFAR's data use community, an open community of organizations and individuals passionate about improving health and healthcare data sharing. Next is Linda Mattox, currently also a senior health information advisor, currently on detail to SCAC from CDC. Her work is focused on advancing availability and use of longitudinal individual level data that are integrated at national level data repositories. Next is Jacob Buehler, Senior Health Informatics Advisor at USAID. He's also on detail at SCAC from USAID's Office of HIV and AIDS. He has spent 20 years in the technology sector and has for more than a decade focused on digital health and health information system solutions for USAID and PEPFAR, supporting a range of in-country activities across sub-Saharan Africa. His telehealth, electronic health records, capacity building, and digital health standards. Welcome to our panelists. Okay. So let's get started. So this question is for all our panelists, starting with you, Ashneil. Could you tell us about your work and describe how it is related to the overarching theme of strengthening national digital health ecosystems to monitor and maintain HIV control?
Thank you for that question, and thanks to everyone for joining both in person and virtually. It's great to see folks in the audience, and it's great to be here in person. I just want to highlight, I was introduced as kind of senior advisor for strategy and innovation, and it's quite an exciting time, I feel, in the trajectory of PEPFAR as an agency. And we're at a point in the HIV pandemic where we're looking forward over the next decade and trying to see if we can really get close to achieving, the ultimate goal around controlling the epidemic, making it less of a public health threat by the year 2030. And our strategy, which we announced just a couple of days ago, last week on World AIDS Day, really attempts to articulate what that pathway looks like and the role that PEPFAR can play in that. And we've really highlighted the role of data and digital as quite central to that pathway. And PEPFAR has, for a long time, been a leader as a donor in terms of really making sizable and concrete investments in data systems so we can understand where our investments are going, how effective they're being, and make decisions programmatically that are more effective. But if we look to the future of the HIV response and where we need to go, a huge part of that is really thinking about how countries can be in the lead of owning and driving the data systems that ultimately they will use to control and manage the HIV/AIDS response in their countries. And so a huge transition that we're all planning to be a part of is how, as PEPFAR, we can make that happen. How do we think about shifting the way that we think about investing in data systems and digital systems, which are quite sizable investments in the scope of the global health ecosystem, but do it in a way that is truly at the center for the data that all of us need collectively in the HIV/AIDS response to make better decisions about the programming that we're all supporting. And so we've articulated a bit of that in the 5-year strategy, and we hope to, over the course of the next several months, elaborate on that in much more detail over time. But we're incredibly excited to, not to say that we're starting on the journey, but incredibly excited to be moving in this direction in earnest, and look forward to discussing some of those themes over the course of the panel.
Great. Thank you, Ashnil, and thank you, Anna. Agree, it's such a pleasure to be at another Global Digital Health Forum, and I've mentioned to a number of you, it is a little startling to be in 3 dimensions again, but also very energizing. Just picking up entirely on what Ashnil was saying, what occupies a lot of my time is running the various teams that enable our routine PEPFAR data reporting. I think for any implementing partners or others that are in the audience here in person and in the virtual audience, knows that the appetite for data in the PEPFAR program has grown significantly over the last decade. I think we also know there is a lot of advantage for leadership in our program for having access to those data to make sure that we have good ability for accountability, oversight, and to measure the impact of the work that we're doing in the PEPFAR program. Exactly though, as Ashnil was saying, certainly from a systems perspective, we are very interested in finding what are many opportunities for efficiencies and streamlining the way in which those data reporting processes occur at the country and the global levels as well. And so in addition, a majority of the effort and the time of our teams centrally are focused on the routine reporting, supporting country teams, supporting implementing partners in that data collection, generating the routine dashboards that drive our quarterly reporting processes, making sure that we are constantly adjusting the trajectory of our country level programs according to those real-time data that are coming in. But a good deal of what we work on as well in the background, and increasingly we're bringing to light, and we have some of the partners that we've been working with behind the scenes over the last years in the audience and at the event today. We have done investments in a variety of global digital goods, communities. Paul's going to speak to one of those particularly that we've invested in over time to achieve exactly what Ashnil is describing, that we can start to shift the parallel, the donor-specific reporting processes that we largely have now to prioritize sourcing data from national systems, making sure those data are useful first and foremost, closest to the point of collection, really prioritizing the improvement of beneficiary care, and largely those reporting requirements for PEPFAR and stakeholders like Global Fund and others, that the reporting we need can be a byproduct of those. Subject matter experts in informatics and information systems that are based at our implementing agencies to coordinate and better align the efforts from agencies supporting individual countries. So we have a one USG, a one PEPFAR approach to the way we're supporting this, and not the what has largely happened, agency-specific priorities from country to country. So lots more to share about that. And then just finally, to leave what I really want to leave the audience with is we are very honestly looking to how we can prioritize reporting and data use at a country level. This will take some adjustments and expectations from both our leadership, but process changes at a country level as well. And so we're very eager to get feedback from participants at the event today and moving forward. And exactly as Ashnil said, we're very excited to be embarking on the development of a 5-year data roadmap activity as well. And we looked for that to be very consultative and would include a lot of the stakeholders in the room to make sure that we're aiming to do achievable things as we work forward in that data roadmap. Thank you.
Good morning, everyone. I see a lot of familiar faces out in the audience. It's nice to be with you all today. I know a lot of you in the audience, but for those of you who don't know me, I wear a number of different hats and do a lot of work with communities of practice in global health and in global health informatics. And I've been honored to have the opportunity to work alongside PEPFAR for a number of years as they share a lot of the vision of what I'm seeing emerge in countries all throughout Africa and PEPFAR-supported countries where there's a very large for information systems, and I've been committed the majority of my career towards helping build that up, working alongside many of my colleagues who are here in the audience. And the constraint that many of these countries have faced over the years could either be looked at as a challenge or it can be looked at as an opportunity for innovation. And what I've noticed in my experience over the past 10 to 20 years is that there are many things, many amazing innovations that are happening all throughout Africa in particular that a place like the US could actually learn from. There's a lot of efficiencies that come from thinking about things under constraint, and those innovations are really important to know about. And so the data use community that we all have worked to establish is an initiative we're going to talk about here a little bit more in this presentation that is really designed to hear from those innovations and to align those innovations such that they can perhaps lend to the understanding about best practices in the field. And we've made a lot of progress with that over the course of the past couple of years, but I think as we progress, we'll talk a little bit more about that. But I represent a number of different communities of practice, and I've been really excited to work alongside PEPFAR in that regard.
I'm the new one on the team. I have the privilege of operationalizing the vision that Ashnil and Mark just described. And that's through a focus on bringing the data that's at the sites together at the national level, and not at an aggregate level, but at the individual patient level, so that we're able to look a lot closer at what's happening in the field. And what that means is that the data as it's collected by the service delivery provider is brought forward together with data from all the different types of interactions that we're we're doing with beneficiaries into an integrated whole that allows us to look at what happens to these people, to each individual over time. And I'm very excited about that because I have over 25 years of working with this kind of data, and there's so much power in it. Most recently, I had the opportunity to work on the domestic COVID response, where by having this kind of data, we were able to respond to the president's, the HHS secretary, the CDC director's requests for what's happening within a couple of hours. And this is the kind of power we want to see happen in PEPFAR.
Great. Good morning, everyone. I was actually late to the stage because I caught up with somebody who I hadn't seen in 3 years. So it just, the power of being in the same place, really to be able to commune with other practitioners and colleagues has just been amazing. So I recently joined the Office of the Global AIDS Coordinator, and I'm really pleased to be working with Mark and his team, supporting global PEPFAR HIS planning, as well as digital health country coordination and implementation. We'll get into this later, but I'm currently supporting PEPFAR's digital health inventory, and this is a global catalog of systems investment activities supported by PEPFAR partners. The Digital Health Inventory, or DHI, is a big step forward for PEPFAR in defining and, more importantly, refining our work in the digital health space, especially as we align our investments to better match architectural needs and national priorities. Another part of my current scope is to help coordinate PEPFAR's Interagency Informatics Working Group, and this is a team comprised of State Department, CDC, USAID, and Department of Defense technical staff working to implement digital health activities globally. Right now, we're actually working to initiate more collaborative activities within and across countries to evolve our digital health portfolios through technical assistance, advocacy, and, you guessed it, problem solving. So we're now actually, to sort of bring those two things together, conducting a review of PEPFAR digital health portfolios with technical staff and country teams for 2023 strategic planning. And really, sort of where we're going with this is trying to bring together what we're learning and then also all of the strategic priorities and objectives outlined by Ashneel and Mark. Really excited to be on this stage and excited to answer and respond to questions.
Thank you very much. Really excited, like the previous speakers have mentioned, to be part of this panel. And I would agree, I almost got late for the same reason. It's been so nice to, finally meet people in the flesh, as we like to say. And we have learned a lot from the pandemic. I mean, we used to say you have the floor, and right now, virtually, we like to say you have the virtual floor. But it's nice to be able to turn that narrative back, to be able to connect in person. And it's been nice to be at this meeting, by the way. I've seen a number of colleagues recognize each other by the voice. Is that you? Our colleagues in this room and also on the panel. I'm personally thankful because over the past 2 decades, we have seen tremendous progress in the digital health space from the e-health days, and really thankful to be connected here with colleagues from Zambia, where my informatics career started about 2 decades ago. I would like to perhaps just associate the organization's work with the PEPFAR strategy and other strategies that we've heard in this meeting. As an organization, as you know, we have been drawing our mandate from the Global Strategy on Digital Health, and key aspects of that strategy on digital health include partnerships, and this is what we're seeing in this particular session. We have a collection of items in that strategy, and we call upon our global community to familiarize themselves with that strategy, with the 172 actions that it promises spread over the short, medium, and long term. The issue around data is critical towards the realization of that strategy. And so the Department of Digital Health, from which I come from, draws its inspiration from that strategy, really using digitalization to fast-track universal health coverage, and really focusing on 3 core areas: the capacity building, whether it's capacity for data scientists, or its capacity to actually develop interoperable digital systems. Second area is really the development of the norms and standards, part of which we hear in this session, around enriching the data content of data systems so as to inform interoperability through what we call smart guidelines, and that will be coming during the discussion. And then the third aspect has to do with really building the evidence base to inform scale. Excited to be part of this journey, and personally I'd like to thank colleagues that I have worked with to really make digitalization a reality, really walking the talk of the transformation we'll be speaking about, and putting equity at the center, putting people first. Exciting moment. And so the 4 items that we'd like to continue to share in this forum is around focusing on the enabling environment so that digital and data systems can thrive, and focusing on capacity, especially the health workforce and data scientists, and really fostering partnership, a culture of working together, and lastly, building and investing on those technologies that are promising. And that's another conversation that we'll embark upon. Thankful to be here on this particular panel, and looking forward to a robust discussion. Thank you.
Thank you, everyone, for helping us to connect the dots on this important topic, and also reminding us about how great it is to actually meet in person. So Ashniel, could you outline some of the key areas of PEPFAR's 5-year strategy, including what you see as PEPFAR's role in helping our partner countries fulfill this vision and goal?
No, absolutely. And, I won't spend too much time going through all of the components of the strategy, as I could spend the next hour and a half taking up all of that. But so I'm just going to emphasize a few of the key elements. But the first thing I just want to draw everyone's attention to, and it's up here on the slide, is the way that we've structured the strategy. There's kind of 5 key priority areas, or key strategic pillars, but then underneath that there's 3 more foundational components that we call enablers. And the one at the bottom here, we've named it Leading with Data, and it was very critical for us to name this very explicitly, because the role of data, as I mentioned in my opening remarks, is central to the way that PEPFAR programs and will continue to be incredibly central. Mentioned equity at the end of the table, and the way that you actually ensure that your program is incredible focus for PEPFAR. But the shift that we're looking to make is one that enables our investments and our support for the data ecosystem in the countries that we partner and work with to be enabling their entire data architecture and ecosystem to thrive across disease areas, not just HIV. And so you'll see us looking to figure out how we can be much more intentional about leveraging our investments to be able to have that outsized impact that goes beyond the HIV ecosystem, because many of these investments are truly translatable and can be leveraged. I think the COVID experience showed us that very clearly, that many of the data investments that have been made in vertical disease areas were able to be leveraged for use cases related to COVID. And so embracing that philosophy is one key element of the strategy. It's really core to the third pillar here around public health systems. There was a mention of partnerships, and I think that's also something I really wanted to highlight, because and I think this room is very reflective of the nature of partnerships that we need. We know that PEPFAR and even the partner governments that we're working with cannot do this alone. There are so many data and informatics needs at the country level, the subnational level, and all of us need to be contributing to that goal. But what partnerships really means is, how can we not just contribute to it together, but collaborate and develop that pathway together, right? And thinking about the workforce requirements that are needed to use the data or develop the systems, the architecture and the infrastructure in countries that are needed for the data ecosystems. Not all of that can be realistically supported just by one donor working on one disease area, right? I think we all acknowledge that. And so thinking about how we can show up to those conversations in a way that is contributing to a broader pathway at a country level and even at a regional level and beyond is going to be something very critical that we highlight in the partnerships piece. And then I just want to kind of pick off a few key themes around how we see the data sort of investments in ecosystems at PEPFAR involving. So Mark alluded to the concept of a data roadmap, and that's something that we've named in the strategy. We really want to be quite intentional and transparent about where PEPFAR is headed with the data streams that we support, the systems investments that we make, and how we see that fitting into the broader vision that I've been describing, many of my colleagues have been describing, what we described in the strategy. And so that is something that we're going to be actively working on in the coming months, and look forward to engaging all of you on developing that sort of data roadmap for PEPFAR together so that we can be quite clear about how we're contributing to the overall ecosystem. The second thing I want to mention is around country systems. And Mark made this point as well, but the shift towards utilizing country systems for PEPFAR's own kind of reporting needs is something that we're going to be quite intentional about how to make that kind of shift in pathway over the coming years. And not to understate the challenges with that, but it's quite a critical priority for us within the kind of whole architecture on leading with data to be able to strengthen and support the country systems, because it's very key to the sustaining the response element of the HIV response. So in the long term of the HIV response, we don't see it as something that PEPFAR will necessarily continue to be the one who's driving the data needs for countries. It should be the other way around. And it's starting to be in many of the countries that we partner with. But what we really see is if countries can truly be in ownership of the systems that they're responsible for, ownership over the program management, ownership over the accountability around the program, that will ultimately lead to a better and more sustained response. And so areas as well. But with that primary intention and that goal being sustainability. Then the last piece I just want to mention is, and Paul brought it up, is around innovation. And this is there is an incredible amount of innovation happening across the ecosystem, but in particular, there is quite a lot of innovation happening at the country level. And so what we are going to want to be more intentional about, and we've named this in the strategy, is how do we effectively surface those innovations that are happening, being tested, piloted, tried out at the country level, being embraced by country level stakeholders, and support them, and really adopt them into the program as quickly as possible, knowing that there's a huge set of opportunity for innovation to leapfrog the way that we collect data, the way that we report data, the way that we analyze it and make decisions based on it, especially down to the individual level. And so that's an area that we're going to be quite intentional about trying to embrace across the countries where we work, and really supporting the country environment for that innovation, as opposed to something that's imposed on a more top-down basis. So those were kind of the key priorities I want to highlight. The last thing I just want to quickly mention is we really see data as a whole ecosystem. It's not just about the systems, it's not just about the workforce, it's not just about the infrastructure, but it's a collective understanding of all of those components that need to be working in harmony. And so it'll be very critical for us as we think about where we're making investments and where we're supporting our country teams and our country partners, how we can enable that entire ecosystem to thrive in all of the ways that we can support it, especially for HIV, but how those ecosystem investments can also be leveraged and enabled for other disease areas, especially in outbreak settings. So that's a key philosophy that we're going to hope to continue to bring to the program and accelerate over time.
So Mark, how does the new strategy respond to global challenges, and how does it relate to PEPFAR's digital priorities?
Yeah, thank you, Anna, and Ashnil, thanks for the highlights from the PEPFAR 5-year strategy. Again, happy World AIDS Day belated to the audience. So we had a number of really exciting events last week, which continue this week with a lot of in-person in energizing and exciting experiences to reconnect here. I think as the 5-year strategy emphasizes, there's a major emphasis on health system strengthening and understanding PEPFAR's role within the broader health system. And for those of you who know our new ambassador at large, Dr. John Nkengasong, you would certainly understand that he is a champion of workforce. He's a champion of local, national, and regional institutions. And he certainly maintains his primary hat as the leader of the PEPFAR program, which remains focused on HIV and AIDS, but continues a broader role within the department on health systems and health system security more broadly. And so I think with that broader frame, we have a really exciting opportunity within our program to really lean in exactly what Ashnil is saying, is that PEPFAR will continue focusing on HIV, but we need to really focus on PEPFAR not being the center of a health system universe. We are an important part in many countries, but how do we reconfigure the way in which the mentality in which we work with country teams to think of PEPFAR as a catalyst and part of the broader health system and not the only disease area that is focused in this data-driven way. And so I think there's a lot of opportunity there, but it also brings up a lot of the challenges which are inherent with that. I think the top of my list here is the sort of the governance and ownership of investments at a country level, making sure that we have good understanding of what data need to sit at what levels, where those come from. I think Linda will talk a lot about some of those considerations as well. And I think another challenge, but certainly an opportunity, as Paul was mentioning as well, is quality of data that we are able to use to monitor our program. But I certainly do expect that we will see more efforts to see how we use those data at lower levels, as I was mentioning in my opening remarks. And it is very exciting for us to be able to talk more boldly with WHO about how we bring in more components of their SMART guidelines framework. There have been a number of sessions at the event this week into our considerations as we are evolving under that broader data roadmap umbrella that Ashnil was referencing, separate roadmaps for each of our key PEPFAR data streams, and looking to adopt more of those characteristics of SMART guidelines. So not just releasing narrative guidelines, but releasing the digital artifacts necessary to uptake those at a country level, regional level, national level, local levels. And with the data that we have with the digital health inventory, which is aligned with the WHO Digital Health Atlas data model, that we have better understanding of what systems are actually out there, what partners are supporting them, so we can focus the technical assistance and align the investments that we make across our country teams and our agencies as well. I think we mentioned it a couple times, but one thing that we are both excited and a little terrified to talk about as well is a movement away from partner-specific systems. And so this, of course, is part of embracing data from a national system, but it really does give us a challenge of understanding a shift in the way in which we may be doing business in the future, where not all data from every country we support would be available for the quarterly business cycles that we run. So looking at potentially an adjustment of how we look at our data, putting more primacy of those data reviews happening at a country level. And that's something we're going to have to work through over time as well. I think just as I close up here, thinking of the catalytic power of the PEPFAR program. There's a lot of efforts we've done with community outreach, with investments in global goods, things that we might refer to in a systems audience as sort of skunk work activities that we knew could be useful in the future. I'm absolutely thrilled that a lot of the investments, the partnerships that we already have, budding partnerships around the SMART guidelines, around some of the really cool things with the Fire native capabilities within the Android software development kit, other things that really give us the potential of a thriving entrepreneurial market around some sort of consistency and understanding of what our reporting is going to look like, so that there are more opportunities for local adaptations around standardized guidelines and understanding how those rock pieces in place, understanding capabilities, understanding the workforce that we have now, and then understanding that those journey to moving in this direction is not going to be a one-size-fits-all approach. That will be tailored, and that we have a lot more data and understanding through our partnerships to understand how we make those adjustments over time. Thank you.
Thank you, Mark, for those technical insights. So, Paul, the data use community has a role in amplifying in-country practitioner voices. Could you tell us what the data use community is, its vision, and how it's working with in-country e-health leadership to support their needs and work alongside them to address these challenges?
So when I hear about the new PEPFAR strategy, it's very exciting to me, personally, on a number of different levels. And I've had the pleasure of being able to work in a number of different environments alongside local leadership now for a number of years. And as just one small example, I was talking with Jacob earlier about the AMPATH program in Western Kenya. And since I would say like the late 2000s, that collection of Kenyans have been working to build medical record systems that have the ability to infer indicators from that patient level record. And I think for a long time, a group like AMPATH maybe might have thought that what they were doing was unusual or outside of the normal way of doing business. But if you fast forward to today, a lot of what AMPATH incredible work. If we think about what has happened over the past 20 years, we've had a number of organizations that are doing global health informatics works collaborating to produce what we now popularized or these global public goods. These collaborations just kind of came out of need. And so I think as PEPFAR describes this vision, and I think it's a grand, important vision where all of the countries that PEPFAR supports have this future state in where they have large-scale enterprise systems that are locally sustainably implemented, and there are all kinds of secondary uses that come from those systems. It's going to be a lot of work. It's going to require a lot of partnership. But in my experience, what I've noticed is that the e-health leaders within these countries desperately want this. This is in their strategy. It's what they're targeting. It's what they're putting energy into. And so the question then really becomes, how do those innovations, how do those examples of success that are being amplified within country influence the rest of the environment around us? And so this is precisely what this data use community is all about. I think there was a recognition by a number of us that these innovators were doing things, but were oftentimes doing it over to the side. They were either so focused on just getting their work done, or they were concerned that maybe the nature of how they were doing things wasn't in line with maybe what the standards of care were. But as a clinician, what I've learned over the years is that a lot of times the ideas in people's minds are what end up changing practice. And I think that's also the case with information systems. A lot of times innovations, these ideas, turn into successful implementations, which turn into regional implementations, which then turn into a common practice. And so I think with the data use community, the opportunity is, and we've seen this, we've seen over 800 different practitioners from many, many countries come and share examples of what's working, but also what's not working. And some of the themes that are starting to come out are influencing the ways in which people are implementing systems, and ideally are starting to influence PEPFAR. And I think that's part of the reason why this partnership with PEPFAR has been important. They've created an opportunity, a safe space for these implementers to talk about the various systems-related challenges, opportunities, successes, and failures, and it's been really gratifying to be a part of that. But I think sometimes just creating some transparency and putting some energy into describing what works and doesn't work within a community model ends up really opening people's eyes to how things can be done differently.
Thank you, Paul, for pointing out how in-country practitioners are indeed key to moving the needle on strengthening national digital health ecosystems. So Linda, why is it important to strengthen national digital health ecosystems that include longitudinal individual level data repositories, and what does that look like?
Thanks. So as you've heard from my colleagues, there's a lot disease. With antiretroviral therapies to a chronic infectious disease, we need to look across what's happening at the sites so that one person who's treated at multiple sites is able to be identified as still in treatment and not as a treatment interruption. And what this, as Ashneil said, this gives us the ability to look deeper into what those inequities are and to develop more targeted, differentiated programming, not just patient care, but also overall programming. So what does that look like? So when we talk about individual level data, one of the very critical things that it needs to, you could go ahead and advance it. One of the very critical things that is needed is the security or information security around that. So in order to bring data together, we do have to have identifying information. So a way to match a person from one site to another site, to match a person who gets one type of service to a person who's getting another type of service. So that involves very, very stringent information security controls. But that type of information isn't needed once we've been able to match those patients together. So the next piece of that is the development of de-identified, curated, or targeted focused areas, data sets that can be used to look at the individual patient level to understand what's happening. Another really key piece of this is the fact that it's as Ashneil and Mark had said, is that it's owned or endorsed by the partner country. Because over time, and even now, we see our ministry partners asking the really strong questions, and this gives them the power to be able to look deeper into the data. And it also, as they've said, we have to do this in partnership because we can't do this alone. And the data for HIV and the data for other public concerns actually has very similar structure when you get down to that root of how the service delivery provider asks the question. And so as we build those structures that give us that flexibility, so for example, I can ask what a test date is, a test type, and a test result, and then update it for HIV in my pick list, say, for the HIV test type or a COVID test type, and I've still got the same information system structure. The last piece that I wanted to highlight is the quality of the data. In order for this to have the power, it does involve ongoing continual data quality reviews. So we're talking about moving up the time frame in terms together. And that helps with the data quality reviews because it's closer to the time when it happened and there's better recall. But one of the key things with the data quality reviews is that gives us a known level of quality. So we don't have to wait 3 years for the data to be perfect, but we can know what our limitations are and make decisions as it continues to improve. And I think I'll stop there.
Thank you, Linda, and thank you for really just talking about the longitudinal level data and the repository qualities that are key for that. So, Jacob, how would understanding and also coordinating of our digital health investments help strengthen our digital ecosystems?
Sure. Thanks, Anna. So maybe just stepping back really quickly, I think PEPFAR as a program has made extremely significant investments in digital health and HIS systems in country. But part of the challenge in the past has really been that we don't know exactly, where they've been deployed. We didn't have this sort of classic data stream or inventory. And while we knew what partners were doing at the work plan level, it wasn't really being surfaced back up. And we knew that other actors, such as the World Health Organization, was building out its digital health atlas. We sort of didn't understand where our partners fit in from an accountability lens. Where are they contributing to either national systems or where are they building their own? I'll give two really specific examples. So, PEPFAR has often supported these HIV exclusive systems, and, Ashnil spoke to this, but they achieved our programmatic objectives, but they typically fractured our national health data and, most importantly, frustrated the local workforce in having to deal with sort of a PEPFAR-centric or partner-centric. So you'll have a partner doing something amazing, either with a mHealth application, but we didn't have any way to promote that upwards. It was really just part and parcel of the work that our clinical providers were supporting. So really to kind of take ourselves beyond this anecdotal approach to saying, oh, we're making these investments and we're using these systems, we started looking at the Digital Health Atlas and said, what if we had our own version, sort of with the same general data model as the Digital Health Atlas, but really focused on our own PEPFAR partner accountability? What are our partners doing within this space? Again, nobody loves a new data stream, certainly not PEPFAR partners, but the way that we're really thinking about this is that as we begin to better understand activities and how they feed back in and contribute to, say, the National Electronic Medical Record System or the LMIS or Lab Information System, this gives us a lot greater latitude to be able to explain to our PEPFAR in-country stakeholders what they're making direct investments in, what's the geographic reach, what are the system capabilities. That's part and parcel of our tool, our digital health inventory instrument. And it's really beginning to start conversations. I'm going to be very candid. I think we've sort of all been able to get to that level of candor. The first year of any data collection activity is never going to be perfect. We're still seeing issues of sort of completeness, interpretation of the instrument and tool. But at its core, the discussion and sort of the conversation that the digital health inventory is sparking is something that we're really excited about because it really brings back to center stage how these system investments are really facilitating, aiding, and abetting the work that we need to do in country to sustain our response. And again, just, when we talk about 520 discrete digital health investment activities, there is a turn of art there. The takeaway here is not that PEPFAR is investing in 520 duplicate or parallel systems. It's that there are discrete systems that partners are investing in, and those activities feed into those. So in the next year, we're actually going to be, working with Derek and with WHO to start aligning our investment activities into the Digital Health Atlas. And in many ways, that's sort of the opportunity and focus. And the last piece, Anna, is really just, how are we using the information? I think I alluded to this. Our informatics working group and our subject matter experts are now going back to country teams to really vet and validate the data we have, ground truthing, what our investment profile is, and then really getting back to that 5-year strategy. Where do we want to go? What do we want to do with our investments to make sure that there is sort of a more lasting systems approach that is not sort of partner-centric, but really focusing on these national level, durable systems so that we can be more data consumers and not data producers within this space. I'll stop there, but thank you, Anna.
Thank you, Jacob. And thanks for your comments on the usefulness of inventorying digital health. And leveraging data as a public good.
All right, thank you so much. Thank you so much, Jacob, for that exciting opportunity to work together. In terms of the points that you've raised, which is a very good question, by the way, and the points that Jacob raised, just want to take this back to what we're actually dealing with here. So you heard me at the beginning talk about a global strategy and its 4 pillars: governance, national strategies, and also the issue of patient centricity, and the issue around skills transfer, those 4 aspirations. We have traditionally required countries to develop a strategy, as you all know, building upon the enabling environment of 4 things: leadership and governance, investments, workforce, connectivity, standards and interoperability, services and applications, legislation, and workforce. Now, in order for us to succeed with getting the ecosystem stronger, it is highly critical for us to ensure that countries are able to A, govern the digital solutions, and then B, have a good lens on those digital systems that are being deployed and those systems that the partners are also deploying. So the Digital Health Atlas itself is the means by which we strengthen national governance, the means by which we ensure consistency based upon a structured nomenclature, which is a taxonomy that defines those digital solutions deployed in a country. Now, we're coming from a time whereby previously because it was so easy to design the systems. Very, very exciting opportunities lie ahead of us because designing these systems has become more and more easy. What the opportunities around governance using the Digital Health Atlas present is really this coordinated approach between what partner actions are like, as Jacob was articulating, what the government actions are like, but more importantly, to really ensure that there is coherence in how one registers, designs, implements a digital solution. The Atlas has a taxonomy behind it, the classification of digital health interventions that is being upgraded, but it also ensures that countries are able to compare solutions with each other. There are countries that have had this big challenge on governing digital solutions, and they've resorted to using spreadsheets, PDFs, using emails, using notepads. And that's been really hard to sort of like ensure governance in those settings. What this approach promises us to do is really better coordination, and at the same time, monitoring what works, where, and to what scale. And so we encourage countries, we encourage partners to really rally behind this agenda, and we're really happy to be able to work with PEPFAR in the coming years towards making sure that there's a global consolidation of digital health interventions in the Digital Health Atlas. And this includes the ability for us to have visibility over what works. Now, the key around data and really promoting those systems that are sort of like emerging, that promote the availability of data, using the lens of a global strategy, we're very keen to ensure that countries are able to learn from each other in terms of what data systems are working, what lessons can they actually draw from those countries, and how can these be promoted as global public goods so that countries are able to share experiences. The lens of the Atlas enables that, and at the same time, the lens of the Atlas ensures good governance. Thank you so much, and back to you.
Oh, thank you, Derek, for those wonderful insights. So our closing question before we take questions from the audience is for any of our panelists, so they can pipe up. What are one or two key actions or steps that the broader collective digital health community can take to strengthen and maximize our digital and data roadmaps towards strengthening national systems? I see Jacob wants to say something.
Reverse the hot seat, which is, I don't think that PEPFAR can do any of this work without the skills, experience, and leadership from its partners. So in some ways, I think this idea of moving from partner-oriented or partner-centric systems to these, nationally governed and, sort of moving from this idea of PEPFAR as, the data-producing beast that people sometimes have previously perceived us to be, into being, the right player in the broader national health data ecosystem and sandbox. I do think that there's a point of reflection for the PEPFAR program to really better engage with implementing partners to help set norms. And I think Mark even alluded to this, but I think there's this fundamental piece of, as I'm building a system, yes, there are data privacy security considerations, but when in doubt, or when we are thinking about, our lasting legacy, how are we ensuring that our, systems and the services that we provide are being integrated into the national HIV response and potentially even being integrated into the community health outreach and engagement? I know that there's been a lot of discussion around greater integration with primary health care, with other vertical diseases. We can obviously talk about COVID being brought more into our sort of common immunization approaches. But I think that, this for partners is going to be a big culture shift. And it does sort of raise fundamental questions about accountability, transparency, how are we supporting host governments, making sure that we're building and adapting systems that not only meet PEPFAR reporting needs, but more importantly, meet the data demands in country long term. I'll state that and stop there. Hopefully others on this panel can either refute or back me up.
Thank you. I see Linda has something to say.
I do. I just want to add on to that. And I think this is, as Paul was saying, it's an incredible opportunity to see what kind of innovation and really creative solutions to the vision that we've laid out. I'm thinking about some of the AI presentations that we had the last couple of days. So I'll pause there.
Mark.
Just briefly, I think one of the things that Jacob mentioned in his remarks around the digital health inventory, and is certainly part and parcel of the underlying concept behind the Digital Health Atlas, is the transparency of these investments. But beyond that, my primary goal with the first year of our digital health inventory collection was not a perfect data set, because no such thing exists, but to facilitate those conversations around these investments. The data are intentionally captured at a partner level, and then the agency and country reviews those with them. And so it's the classic touching different parts of the elephant and understanding what you're supporting. And so I think one of the that must happen as part of the data roadmap and the operationalization of the new PEPFAR strategy is really how are we making sure that we are building more literacy across all members of our program. I think a lot of our more senior individuals in the office certainly prioritize data, but they may not have a lot of visibility to what it actually takes to generate it. And sometimes what we're asking for may
world can do. And so I was trying to think about it with that lens. When it comes to this vision that we've heard talked about during this presentation, I'm assuming that many of you in the audience are thinking one of two things. You're thinking, I am doing something that could contribute to it, but I'm not sure that people are aware of its potential, or I have X, Y, or Z problem that I'm trying to grapple with as I work alongside a country, and I don't know how to resolve it. Those are really common things that we hear within the data use community. That's the forum exists specifically to have those kinds of conversations. I assume that many of you here already have been a part of it, but if you would not, just come to the data use community web presence. We have really great both online forums, and we have calls where we're literally talking about these issues in real time. Sometimes those calls have upwards of 200 to 300 people on them. So my request would be, if you have either hard questions that you don't know how to resolve, or you have ideas about something that works and that should be more broadly scaled, both within a country and across countries, we would love to hear about that.
Thank you, Paul. Yes, Derek, go ahead.
I'm supposed to be from the digital health department, so apologies for the delays in getting the mic activated.
No worries.
All right.
No worries.
All right, a couple of thoughts. Totally agreed with the points that have been raised. And once again, from the global strategist perspective, I think we want to just highlight 4 things that we really need to push forward. A number of us are aware of what it takes to transform an ecosystem. It's the people, it's the processes, it's the technology, would also say the culture. And we're pleased to actually see how the strategy looks at the people side of things. I think whether it's data literacy or digital literacy, rubber hits the road, so to say. So really continuing investing in people and making sure that no one is left behind, whether it's policymakers, planners, or the practitioners themselves, or even the people that are in digital solutions. So these are some of the items that we really like coming out of this strategy, consistent with the global.
I see that Kathy has a mic, so if anyone has any questions, just raise your hand, and she name and ask your question.
Thank you very much. And TNA from Kenya. And I'm looking at the slide that is projected there. And one key word, or 2 key words that are very critical to me are strengthening and then national. Coming back to my question is that there's been a lot of work that has been done in so many countries, and I think and other partners who have been in that space, particularly on creation of digital health solutions in countries. But because countries have been disparate to get immediate and quick solutions, this has also led to disparate problems. Because we've had disparate solutions, I give you an example of Kenya, where in the HIV world, we had at one time more than 40 different types, none speaking to each other. And of course, you know what that means, that even the issue of monitoring and really evaluating what is happening could not take place because of these disparate systems. And of course, that has also led to a lot of disparation to countries. Now, the question that I wanted to raise is the issue of respecting the legal environment that is fast evolving in some of these countries. If I speak, for example, on behalf of Kenya, we now have the Data Protection Act in place, which really stipulates the fact that the owner of the data is the data subject. That revolutionizes the way we think, that revolutionizes everything else that we do. And that is perhaps why in Kenya there are a number of other things that are taking shape just to try to conform with the law. But the more we talk about this, and the good talks that we hear here, when we go back home, we find the opposite, particularly from the partners who are in the field. how I hope this message goes straight to the partners who are supported through the mechanisms that are in place, so that they start really to think about strengthening and the word national, because so far it is still a strange word in the local setup. Finally, there is this question of sustainability. Of course, systems will not be sustained in the long run if the government does not put in money. But how does the government put in money in a space which is not controlled, in a space where there is a lot of disparity and confusion? So these are some of the things that I think we always need to put behind our minds and to see how we can support countries through partnerships that are in place to respect those two words, strengthening and national. Thank you.
I'm happy to start, and I welcome other colleagues to join, but I think the sentiments you're raising are exactly what we're trying to aspire towards. And what I will say, and what I hope to emphasize is, the strategy is, we're not intending to have all the answers tomorrow, right? But the spirit in which what we want to achieve is very much aligned with the direction that you're outlining. And so, what I'd ask of you and all others in the room is to be honest with us about where you see the opportunities that either are missed or opportunities that we can take advantage of to move in this direction in a faster way, right? And I think we've been relatively frank, certainly Jacob put it very clearly about the fact that many of the investments that we've made have contributed to that fragmentation. And it has made it harder to strengthen national systems, and we're being honest about that. And certainly in the future, we want to make some intentional changes about the way that we program to move in that direction over time, right? But we know that's not going to be a process that can change overnight. It will take time. And we'll have to work very closely with the government and with all of the partners in country to achieve that vision and to align around a vision that is government-led, ultimately to get to the level of sustainability that you named, that we've also named in the strategy, because we very much agree for the data systems to be ultimately sustained in country, to be financed by the government, to be owned by the government. The government needs to be at the center of defining those priorities and defining the pathway in that country. And so we're hoping, as part of the strategy and as part of our programming going forward, to more intentionally align with that philosophy. But not to say that that's going to be easy, and I think there's a role for everyone in the room to continue to provide us expertise and guidance as we're looking to make these shifts about how to do it well in the countries where you work.
Thank you.
And I might just add on really quickly, the point is very well taken, and completely agree with the points that you've made and that Ashnil has made as well. But on the data protection legislation that you've mentioned, and Kenya, a lawyer, and I don't know if any of my colleagues up here as well, but what we are seeing, of course, is that many nations are putting forward these very important legislation. And I think what's important for us as a program, and one that works very closely in a global health ecosystem, is how do we see that legislation, those policies, as enabling and not as a barrier. So really thinking about the lessons learned from COVID. How do we understand what that minimum data set around understanding a disease epidemic, something chronic, that we can share without needing to litigate it multiple times? So us in our level, those technologists at lower levels don't need to bring in lawyer after lawyer after lawyer to make sure that they can actually share something. So agree with Ashnil, it's not going to happen overnight, but completely agree that we need to prioritize the national priorities, of course, but make sure as well that we have an enabling legal environment for sharing as well. Over.
Thank you. Derek.
Yeah, very quickly. Thank you so much. I agree with my two colleagues, and Dr. Sitine, thank you so much for such an important question, which actually should be taken seriously. So the points I think you raised included questions and also points which were right on target. So two things very quickly that I would like to add on. I think Dr. Sitine raised a very good point around making sure that governments are in the driving seat, because more often than not, they're on the side or behind the driver's seat. But the point I wanted to really encourage, member states here and partners is really making sure that the whole of government approach we've been teaching or talking about, and the whole of society approaches, are really put into practice. In the past, our emphasis had been on the Ministry of Health. But we have to, graduate towards thinking about the health sector, because there's so many actors in that ecosystem. So the governance approach really should go beyond the building the Ministry of Health, but including other actors, ministries of ICT, education. We see this in many countries, and this is one of the objectives of the global digital health strategy, to really ensure that there's this governance aspect through the DHA based upon the digital health interventions. A key area that I think is an opportunity to ensure interoperability is WHO's work on smart guidelines, because that work on smart guidelines has a promise of ensuring that there's consistency in the data that is being collected, and at the same time that these data systems have rich data that would enable quality of care, artificial intelligence, and other subsequent interventions. So really building on this emerging area of smart guidelines will be a significant investment for member states partners in times to come. Thank you so much.
Thank you. I can see some hands in the back. Kathy? Yeah. Go ahead.
Good morning, everyone, and good morning, panel. My name is Innocent Chiboma from Ministry of Health in Zambia, and my question goes out to, I think, everyone, but especially to PEPFAR. So we're wondering, how can we practically make this happen at the country level, where using PEPFAR funds and PEPFAR support for this, so PEPFAR has helped us build systems, and we've built systems, but they're very, very HIV inclined. But then this is software. It can be used. I mean, it can be extended to other areas at country level, so that they are just as useful everywhere else. But we don't usually. I know maybe it's changing, but we don't usually receive that support where we can be able to extend the software to do the other things that we want to do as countries. So practically, as a PEPFAR, how can you answer that? How can you help us to be able to do that, so that we can be able to use the systems for everything that we would like to do? Thank you.
I'll start. It's a very important question, and I'll let Ashneil shut me up if I go in the wrong direction here. But I think part of, as the data roadmap activity that we've referenced, one thing that I have really been saying to my leadership and then to Ashneil and the front office as well, is it would be very helpful for us to have those high-level characteristics of what we expect to be in the data roadmap in advance of our upcoming annual planning processes that'll be that you're familiar with, of course, in February and March. And I think a lot of this is to give some clarity and some comfort to country teams around the way in which systems are built, the priorities for the program moving forward, and what we've said a number of times, some transparency and some consistency in what you may expect moving forward. Particularly to what you're describing. If we're really talking, and we heard the point from Kenya as well, that you want these to be national, you want them to be strengthened. I certainly can't make commitments beyond 1 year, but what we can say, and what we often find in systems, is if there's a strong value proposition, you will find the resources, whether it's from PEPFAR or other places. And so I think it's hard to make a value proposition to a broader ministry if you're saying this is only serving HIV, and within HIV, it's largely serving PEPFAR as a donor. And so really making sure that we are beyond the words, saying this is important, and these are the characteristics of what it looks like for that system to be owned, and then that you have infrastructure and standards that allow you to maybe not use PEPFAR resources specifically, but that infrastructure can be repurposed with existing workforce in country, other capabilities that you can build up. So again, PEPFAR is a catalyst, but not the only one funding that.
And the ministry was able to work with Global Fund to support development of a TB module in the same EMR. So that's one practical example of that. And the other thing is that focus on how we collect the data. So collecting the data as it's asked rather than interpretive is another way of introducing that flexibility.
Thank you. Go ahead, there's a question in the back. The microphone.
Thank you.
Yes, go ahead.
Good morning, everyone. My name is Karo Kamasaka from Uganda. My question goes to Jacob and Derek, but also it is something that us as partners and donors can maybe go back and reflect on. We are looking at strengthening national digital health ecosystems, and in strengthening, we are also looking at doing away with duplications. But then I've been seated here and looking at what PEPFAR has developed to track their initiatives, and then the Digital Health Atlas. And I'm wondering what the difference is between the two. And also thinking, isn't this also creating another duplication and putting burden to countries to use those two tools to follow up on the interventions that are being supported by the same partners? So I think it is also something that we can reflect on as partners and donors while we invest into strengthening national digital health ecosystems. Thank you.
Great question. And, again, the cardinal sin of creating a new data stream is that it's one to be duplicating another. I'll be very frank, which is that in my ideal world, we would be driving and directing and setting requirements that partners would be entering information into the Digital Health Atlas, so that would be a singular approach. Fortunately, or unfortunately, depending on where you sit, there's a very strong appetite to understand what partner contributions are in this space. And the current WHO Digital Health Atlas, while there is sort of partner attribution and pieces like that, we are asking for some very PEPFAR specific information. What budget is it coming from? Is there an estimated annual budget? Things like that that we wouldn't be bringing into the Digital Health Atlas. They're working with the Ministry of Health, government counterparts to ensure that the digital health systems that they're investing and supporting are well registered. And in fact, one of the things that we didn't specifically or explicitly say, but in 2023 we are looking to confirm, I won't say validate, but sort of confirm specific Digital Health Atlas entries using the DHI data as a way to kind of have that conversation in terms of partners, stakeholders, and country. We haven't gotten down to brass tacks on those specifics, but that's something that we are working to plan out in the coming year. But again, completely agree. Why am I doing this here, and then why is it over here as well? Really, we will see a convergence over time, but for now, there's still kind of a PEPFAR partner accountability lens that's related to the DHI. I don't know, Derek, if you want to.
Yeah, thanks. And this is where partnership, coordination, and collaboration comes in. We have to have the conversation as we're doing here. And I think, Carol, your point must be also taken seriously, because we recognize that the Digital Health Atlas is one of those actions in the global strategy on digital health within the spirit of governance and coordination. And so, as Innocent rightly pointed out, software is soft, right? The issue around coordination is extremely important in terms of ensuring coherence. So making sure that systems that are collecting information that is complementary are able to talk to each other. This is a conversation that we will need to continue having to ensure that data exchange of similar systems, not only the Digital Health Atlas, but there are complementary systems that would be very keen to feed into the DHA. And once again, the work effort for next year, validation, but also encouraging countries to use the Digital Health Atlas, because we still have challenges with getting the Digital Health Atlas utilized by our government counterparts. We do have a course on the Digital Health Atlas. We do have an overall course on that digital health management that our colleagues at USAID and WHO have been working with us. But we need to sort of like get this utilization so that beyond data entry, we should be discussing data use. Okay, and so that's the direction that we like to push the agenda towards. Thank you so much, Carol.
Thank you. I think we have time for one more question. Go ahead.
All right. My name is Teddy Barihun from Palladium Group. Thank you for the presentations. I think it's great to see the recognition from PEPFAR in terms of health information system investment in countries. We can come up with a lot of great examples how PEPFAR supported the health information systems at the country level. But at the same time, I can also mention a long list of ways PEPFAR undermined countries' health information system because of the approach they were following. So from the point of candidness and openness that you have showed, I have the strength to tell you that countries to transition from these silos that we have created. The change management requires investment, PEPFAR investment, because we caused this issue. So I want to hear from you what's the commitment in terms of PEPFAR to invest in that change management. Not investing in other systems, maybe. You might have to invest only in PEPFAR, but the change management requires investment, and that's what is the commitment from your side on this strategy. That's one. And the second question I have is for the national digital data repositories. And more I'm hearing this, PEPFAR is encouraging these national data repositories, which we are bringing a lot of individual level data at the national level, centrally. We all know that's going to attract attention of a lot of hackers to get their hands on the data, and we know the infrastructures are weak at the country level. So I don't know what is the approach that we are thinking, the way PEPFAR is going to be supporting these national data repositories from the point of security. Thank you.
So maybe I'll start with the first question, and I'll let others answer the second one. But it's a incredibly well taken point around the need for change management as part of this process. And I mean, one of the reasons why I stress that in my answer to an earlier question around, this will take some time is in part because of that change management process. And there are some, core needs around the HIV program around ensuring that data is coming, reliable quality data is coming from some source to help provide that programming at all, at all levels in all years, right? And so managing the transition and building up national systems as we de-emphasize more and more investment in parallel systems is not an easy conversation, nor is it something that we can have at a general level. It is a very country-specific discussion that needs to happen, and that planning needs to happen with all of the stakeholders in country. But certainly the change management cannot be underestimated in terms of the needs and in terms of the alignment that needs to happen across a whole host of stakeholders within the country. And so certainly in terms of commitment, I think it's very much recognized that that's going to be an essential part of how we need to move forward. Not to say that we have the answers on how to do all of that, but we know that that is an important task in front of us. And I think we do have some examples and stories from specific countries that we can lean on as we do this in more and more places.
Thank you. Linda, I think you have a comment?
I guess they're going to leave it to me to answer the question about information security. We take that very seriously. And in the guidance, it is a requirement of bringing the data together. But each country's situation is different, and we also look to our colleagues in country to provide some of that. I think Jacob called it ground truthing in terms of what's actually possible and what can be done. Especially as we think about key populations, maybe we don't bring risk data into the central repository so that you can't identify The US standards are fairly high, and that's part of, many examples that we could bring in and think about how do we provide that security in country.
And I realize we've gone over time, but just, it's such an important point, and it's so critical to everything we're outlining here, is actually how do you pay for these things? I've mentioned before, and I would be remiss if I didn't end with this, is that PEPFAR cannot and should not be funding this alone. And so it's very intentional. We have partners from other organizations on stage with us, in the audience as well. Donor coordination and making sure that we have good understanding of what national priorities are, how they serve donor needs, but also that we have clear opportunities for co-investment from other organizations as well. So, point very well taken.
Thank you, Mark. Really great questions, and what a rich discussion we've had today. I'd like to thank our great panelists and the audience for their valuable contributions on this very important topic. This brings us to the end of this session. Please enjoy the final day of the conference, of this wonderful conference. Thank you.